Hey there.
So I hope you all have understood the case taking part 1. In this video we will continue to part 2. Whichever points have remained, we'll cover them in detail in this video.
Then occupational history. We must inquire patient about his occupation as it may give us clue regarding previous or present occupation and some diseases which are related to the occupation of the patient. For example, there may be certain diseases which are related to certain occupation. For example, silicosis, which is a lung disease caused by inhaling silica dust, common in mine workers and construction. Asbestosis, lung damage from inhaling asbestos fibers, which is often found in construction and shipbuilding. Then carpal tunnel syndrome, nerve damage in the wrist from repetitive motions, common in office work and assembly line job. Then noise induced hearing loss, hearing damage caused by prolonged exposure to loud noise, common in factories and construction sites. Lead poisoning, health issues from exposure to lead, often seen in industries like construction, painting and battery manufacturing. Dermatitis, skin inflammation caused by exposure to chemicals, common in healthcare, cleaning and manufacturing. Next important aspect of case taking is marital status of the patient. While we are taking the case of a patient, we must take into consideration whether the patient is married or unmarried, as psychosocial and emotional health of the patient matters, while marital status can reflect a patient's support system, which plays a key role in recovery and overall health outcomes. A patient's marital status may influence their lifestyle and health risk. For instance, studies referenced in medical literature show that married individuals may have better cardiovascular health, while single or divorced or widows might have higher rates of mental health disorders like substance abuse also or chronic diseases also due to social isolation. Also, reproductive health. Marital status is important when taking a case history related to reproductive health. It can impact considerations for contraception, sexually transmitted infections, fertility, pregnancy related issues. This medical history also includes understanding the dynamics of sexual health in context of marital relationships, which can affect treatment plans. And most practical part of asking marital health to the patient, that the marital status can affect medical decision making, particularly in elderly or incapacitated patients. In cases where patients cannot make decisions for themselves, a spouse might be a key decision maker or have specific insights into the patient's medical history or preferences. Okay. Next is living circumstances. Living circumstances are an important aspect of case taking as they provide insight into the patient's environment, lifestyle and potential factors that could impact their health. For example, a patient's living situation can reveal socio-economic factors such as house quality, financial stability and access to resources like food, transportation, healthcare, etc. Poor living conditions such as overcrowding or unsafe environments can contribute to both physical as well as mental health issues. Another is environmental exposures. The patient's home environment may expose them to certain risks like allergens, pollutants, or unsafe living conditions, poor sanitation, hazardous living environments, etc., which may play a crucial role in creating conditions like asthma, respiratory diseases, or infections, etc. So next, history taking in children or case taking in children, which consists of prenatal, postnatal, developmental history and immunization history. About records of immunization, we have to take into consideration that it is a pediatric case taking history, which is important, but we have to gather detailed information on various aspects on child's early development and medical history, including its prenatal, postnatal and immunization records. These components help in providing the child's growth, identifying the potential health concerns and ensuring the appropriate preventive care. So this is a totally different branch from adults. It is pediatric case taking. We must enlighten ourselves that we have to take into consideration 4 important aspects while they are case taking. First is prenatal. Prenatal means what? Maternal health, information about the mother's health during the pregnancy, as if she had the conditions like diabetes, hypertension, infections or any substance use. It can affect the fetal development. Ask about any complications such as gestational diabetes,
preeclampsia or infections like rubella or cytomegalovirus. Then you can ask the mother about the medications and lifestyle during pregnancy. It's important to look into whether the mother has took certain medications, supplements like folic acid, or had any lifestyle factors like smoking, alcohol use that could affect the pregnancy and fetal development. Prenatal care details about number of antenatal visits, screenings, for example ultrasounds, blood tests, and any concerns raised during the pregnancy, intrauterine growth restriction, etc. It may provide context for child's health status. Last but not least, do not forget to ask the complications during pregnancy or birth, information related to prematurity, maternal infections, or fetal distress during labor. It's important for governing the potential impact on the child's development and health. Then postnatal history. Birth details, information on type of delivery, whether it was vaginal or C-section, the birth weight, and any other complications during delivery, for example birth asphyxia, meconium aspiration, are key factors. A history of resuscitation or neonatal NICU admission should be noted. Immediate post-birth care. Assess whether the child had any initial health concerns such as jaundice, feeding difficulties, or breathing problems. Developmental milestones. The child's developmental milestones are crucial for tracking growth. These include motor skills, for example crawling, walking, language development, and social skills. Delays in any of these areas may suggest underlying conditions that need further investigation. Feeding history. Information on whether the child was breastfed, formula fed, or had any feeding difficulties such as colic or reflux is important in understanding the child's early nutrition and digestive health. Then immunization records. While we are asking about immunization history, we must take into consideration the vaccination schedule. Record the vaccination the child has received according to the National Immunization Schedule. This typically includes vaccines like DTP, diphtheria, tetanus, pertussis, polio, hepatitis B, MMR, measles, mumps, and rubella. Others. Missed or delayed immunization. It is essential to identify if any of the vaccines were missed or delayed, as this can impact the child's susceptibility to preventable diseases. Adverse reactions. Document any previous adverse reactions to vaccines such as fever, rash, or more severe allergic reactions were there. This helps in future vaccination planning and ensures safety. Booster shots. Ensure that the child has received appropriate booster vaccinations at recommended ages, for example DTP boosters, MMR boosters, to maintain the immunity. In diet history. The diet history is essential in case taking as it helps in identifying nutritional deficiencies, imbalances, or food related conditions that may impact health. It also guides healthcare providers in making dietary recommendations for disease prevention and management. Most important thing while we are taking case of a female, we must take into consideration the menstrual history, whether the menses are regular or irregular, or what kind of discharge or flow is there during menses. For brief, we'll take into consideration the following points, that is the age of menarche, duration of each cycle, are the menses regular or irregular cycles are observed, appropriate volume of blood loss in each menstrual cycle is there or not, age of attainment of menopause, postmenopausal bleeding, whether it is present or not. In obstetric history, the following inquiries are made. For example, number of time the patient conceived, number of time pregnancy was carried to the term, number of abortions, whether it were spontaneous or therapeutic, number of living children, the ages of the living children, the age of the last child delivered, the time interval between successive pregnancies or abortions, mode of delivery, whether it was vaginal, forceps assisted, or cesarean, development of edema on the legs, hypertension or seizures in the antenatal and postnatal period. Seizure within 48 hours of delivery is due to pregnancy induced hypertension, that is PIH. Beyond 48 hours it may be due to cerebral sinus thrombosis. Then presence of impaired glucose tolerance in the course of pregnancy or history of having given birth to the large baby may give a clue to the presence of diabetes mellitus in the patient. Next, family history. While we are taking into consideration the family history of the patient, we must inquire about the presence of consanguinity in the patient's parents or any disease states in the patient's parents, brothers, sisters, and close relatives. Presence of diseases like HTN, DM, IHD may make the patient more prone to develop a similar problem. It's prudent to record the state of health, important illnesses, the cause and age of death in any member of the family may give us clue to the presence of any history of certain conditions and development of IHD. So, presence of hereditary disorder prevalent in the family should be inquired for. Marital status of patient and number of children that the patient has should be inquired for. Infertility in a patient may give clue to presence of immotile cilia syndrome, cystic fibrosis or Young syndrome. Why is it important to take the history about the drugs and allergies? Because while we are addressing to certain patients, we must know what we should give and what we should avoid. For example, avoiding adverse drug reactions, identifying allergies to medications or substances ensures that the patient is not prescribed drugs that could trigger harmful reactions such as anaphylaxis, rashes or other severe side effects. Preventing drug interactions. Knowing the patient's current medications helps identifying potential interactions between the drugs which can reduce the effectiveness of treatment or cause dangerous side effects. Safe treatment planning. A patient's drug history allows the doctor to choose the most appropriate treatment, avoiding medications that the patient had negative experiences with or that are contraindicated due to their medical history. By understanding patients' drug allergies and sensitivities, the doctors can personalize treatment regimens to improve outcomes and minimize the risks. And so it ensures safe, effective and individualized medical care. Thank you for listening patiently. Stay tuned for more such videos. Thank you.